Hello viewers, today we'll talk about reverse shoulder replacement with Dr. Prathmeshan. Sir, what is basically reverse shoulder replacement?
A reverse shoulder replacement is a very new technology in which what we do is we shift the biomechanics of the shoulder. What we actually do is we make the ball into socket and socket into the ball. So this is the normal ball part of the shoulder joint that is converted into the socket. This is the socket part of the joint and that is converted into the ball. And then we apply it like this, and this becomes a functional reverse shoulder replacement. This is a bail-out treatment for any bad problem of the shoulder. Shoulder arthritis, shoulder pain, any bad shoulder fracture, any sequelae of bad fractures, any bad trauma case, arthritis of the shoulder, untreated, untreatable, unreducible rotator cuff of the shoulder. You name any bad problem of the shoulder which was treated as a non-treatable treatment like 10 years before can now be treated successfully with a reverse shoulder replacement. So this is a boon for those patients who are having bad shoulder problems which was earlier considered to be non-treatable.
So it is basically the opposite of the anatomical
Yes. So normal shoulder, the normal shoulder that we have a ball on this side. Instead of this, there is a socket. And this is a biomechanical advantage joint. So this joint will give rise to a very good success, very good recovery, and very good function to the patient. So overall, this leads to a very good result for the patient's perspective.
as compared to the total
shoulder, and it gives a very much a positive biomechanical advantage to the patient's shoulder. So if we talk about biomechanics, it puts the deltoid into the advantage. So the deltoid will take care of the function. So if there is a rotator cuff tear, the patient will not be able to do up. But if you do reverse shoulder, the deltoid will act into a positive functional position, and the patient will be able to do a full movement or full function of the shoulder with that reverse shoulder joint.
And so since how long has this been into practice?
So reverse shoulder, we did the first case in Gujarat in 2012. So we have been doing this for about 13 years now. So we did the first case in 2012, that was with a debut joint, which was unfortunately discontinued. And then we started doing comprehensive reverse shoulder since 2016. And then we are doing this reverse shoulder since it is launched in India for about 13 years. And the results have been very, very promising. And we have got a good results and good long series of these kind of a reverse shoulder for all kinds of bad shoulder problems. And the patients are doing phenomenal.
So there must be so many advances that have been launched with this.
So recently we have started doing augments for reverse shoulder replacements. So this augments is a very new technology, and this is basically for bone defects in the glenoid. So in the glenoid, we can have a superior wear, or you can have a posterior wear, or you can have in very rare chances, you can have an anterior wear as well. And any of these wears can be treated very nicely by using augmented base plates. So augmented base plates again has been introduced in the Indian markets very recently, like the last month, and we were fortunate to do the first two cases in Gujarat with augmented reverse shoulder base plates. And this is a boon for those patients who have bad shoulder problems with a wear in the glenoid. So if you have a wear in the glenoid, there is a posterior wear or there is a superior wear, so we can use augment specifically to reconstruct those wear. And this also leads to a very less bone loss. So with this is called as a bone preserving thing. We are able to lateralize the base plate and thereby increasing the function, accuracy, decreasing the pain, and increasing the function of the patient.
And so we have also heard about some 3D planning related to the...
So again, we were the first one to do the 3D planning and 3D surgeries in Gujarat. So what we do is basically we do 1 mm CT cuts. And this CT cuts basically will lead to there are 3D printers, and they can give us a 3D model of the scapula and the shoulder itself. So what it does is we can pre-operatively know what is the wear in the shoulder, and we can plan our surgery according to that. So there are softwares to plan the surgery. So you can either plan the surgery online on the computer, like which is called as a pre-op planning, Or the second option beautifully that they give us is they will give you a 3D printed jigs. So that is actually a jig which can be planted right onto the glenoid, and we can make our surgery very, very precise to the tune of about 1 mm. So this is possible with the advancement of the technology that is called as a 3D printing. This is almost equivalent to a robotic technology, and we can actually make the whole of the surgery pre-planned and very precise and accurate by using the 3D printing technology and 3D printing jigs. So we will be making a very detailed video on that. So if you are interested, you can just subscribe to our channel. We'll be uploading the other video in which the 3D printing technology, how we do 3D printing, how is the model made, how we place our jig, how we make the first jig, and how we make our basement position very accurate using 3D printing. So that will be covered in the next video very soon, which will be uploaded very soon.
So are there any special doctors and technicians for the 3D planning
Yes,
that you
yes.
do
So that
prior
is
to the
yes. So
surgery?
that is. So you'll be very happy to know that now in Make in India initiative, the 3D planting, previously we used to send the data outside and it used to come from France and Germany. Now in India also there are certain companies which are doing 3D planning softwares and 3D printing as well. So now we have the 3D printers available in India, and the 3D planning is now can be possible locally in our setups.
Okay. And sir, the rehabilitation regarding the reverse shoulder.
So the reverse shoulder is a very advantageous surgery as far as the rehab is concerned. So we need a very minimal physiotherapy, very minimal rehab. The recovery is excellent. You need not to do very great sort of exercises, just small sort of exercises are okay, and we guide our patients specifically, but not a lot of physiotherapy is required. The recovery is very smooth. You can start moving your hand very quickly and without any effort. So the post-op rehab of a reverse shoulder is much quicker as compared to anatomical total shoulder procedure.
So what is the longevity of this?
So reverse shoulder, the newer processes, the earlier processes were doubted to have a low longevity, but the newer processes that we are using are uncemented designs, and they are supposed to be lasting about 15 to 20 years. So we have been doing these surgeries for 13 years now, as I told you, and the success rate has been very nice, and luckily I have not revised any shoulder due to loosening in my 13 years of career. So no loosening so far, and we are expecting that at least they have a longevity of 15 to 20 years. And it may be more because it is a non-weight bearing joint. You don't put weight on the shoulder when you are walking, like in a hip or knee joint. So the longevity is good. And so any patient who is more than middle age, we can safely do reverse shoulder with very great results.
And so what are the specific implants the company?
So there are many companies which are in market. My personal favorites are Zimmer Biomet Comprehensive System and the Stryker. The other companies that are available are Arthrex and Evolutis. There are many companies, but you need to have a very good understanding because it's a surgery which needs a great deal of knowledge, training and efficacy from the surgeon's part. So definitely this surgery has to be performed by the specialist.
And sir, any extra things that you would do?
That is it. From the surgeon's perspective, a good training is must. So if you are an orthopedic surgeon and if you want to get a training into reverse shoulder, we are always more than welcome to help you. We routinely perform training programs for beginner orthopedic surgeons to learn reverse shoulder. That is one. And if you are a patient, then obviously the reverse shoulder procedure, you can plan it at a center which is a high volume center of a reverse shoulder, so that you can get the best possible result.
So viewers, if you are having a bad shoulder problem like old fracture that cannot be treated, or severe arthritis, or even if you need a revision replacement, you may contact soon on the number given below. You may send your reports, MRI reports, CT scan reports, and contact us. Thank you very much.